Grand Nursing Theorist Dorothy E. Johnson and the Behavioral System Model by Amanda Martinez, Dan McMunn, and Gael McLean. Johnson was born in Savannah, Georgia on August 21, 1919, raised by a father who was a superintendent of a shrimp and oyster factory and a mother who loved to read. Johnson retired in Key Largo, Florida, where she collected seashells before her death on February 1999 at 80 years old. Johnson completed her associate degree at Armstrong Junior College in Savannah, Georgia. Johnson developed a passion for children, education, and nursing, working as a teacher during the Depression. Graduated first in her class with a bachelor's degree in nursing at Vanderbilt University, receiving the prestigious Vanderbilt Founders Medal. In 1948, she graduated with a master's degree in public health from Harvard University. Johnson worked as a staff nurse at the Chatham-Savannah Health Council. She then returned to Vanderbilt University, where she taught pediatric nursing for 5 years. In 1949, she took an assistant professor of pediatrics job at UCLA, where she was promoted to professor and stayed until retirement. Johnson served as chairperson of the California Nurses Association from 65 to 67. Johnson and her colleagues founded the first 4-year nursing program focusing on educating nurses in the sciences. She received many awards throughout her career. In 1980, she introduced the first written form of the behavioral system model. Johnson continued to work on research and her theory even into retirement. Johnson published 4 books and over 30 articles. In 1968, her one conceptual model of nursing paper was published and is seen today as a classic piece of nursing literature. 2 other articles published by Johnson include Theory Development, What, Why, How, and Barriers and Hazards in Counseling. Johnson entered her nursing career towards the end of World War II. During this time, Congress passed the Cadet Nurse Corps to financially aid nursing students to complete their degrees. After World War II, hospitals began to expand due to the Hill-Burton Act, resulting in a severe nursing shortage. The Nurses Act of 1949 strengthened the educational role of the General Nursing Council. In 1965, healthcare changed, providing care for the underprivileged and elderly. Hospitals were often seen as overcrowded and understaffed due to the many nurses stationed at military hospitals. Back home, many quit nursing to care for families or changing professions. Nurse refresher courses were offered to nurses who left the profession to aid in the demand for nurses. Nursing began to be viewed as a profession. Nurses were needed like never before. In 1946, polio came to the U.S. and continued until a vaccine was created in the early 50s. Johnson viewed individuals as stressed. She believed that biological, psychological, and social forces must be balanced with each other, reinforcing an equilibrium. Inspired by Nightingale, she began applying how the nursing profession has an impact on patients and society's welfare. She agreed with Nightingale's environmental theory, viewing the fundamental needs of the patient and not just the disease process. Johnson viewed nursing as an art with a behavioral aspect, not just the biological aspect. These concepts are reflected throughout Johnson's behavioral system model. Talcott Parson was an influential education and sociology scholar. Most of his work focused on structural functionalism. His early writings included ideas of a behavioral system model. He believed in combining functionalism with structuralism. Parson and Johnson share the same components of the social system: goal, set, choice, and behavior. Johnson recognized a lack in holistic nursing education. She was able to apply theories from Seil, Grunker, and Buckley from sociology and psychology to the nursing profession. Johnson developed a behavioral system which focused on specific behavioral responses on their theories. The behavioral system model advocates the fostering of efficient and effective behavioral functioning in the patient to prevent illness. Johnson stresses the importance of research-based knowledge and utilization of the nursing process and to determine the effects of nursing care has on the patients. Inspired by Nightingale's environmental theory and theorists from other disciplines, she believed humans were behavioral beings. Combining biologic and behavioral systems, she used an individual's behavior to modify their health and well-being. The theory utilizes 7 subsystems. This slide breaks down Johnson's meta-paradigm concepts of nursing. This slide displays and defines the 7 subsystems of Johnson's behavioral system model. Maintaining equilibrium between the subsystems is key. Each subsystem is described and analyzed in terms of structural and functional requirements. This slide identifies and defines the 4 structural elements, including drive, set, choice, and action. The functional unit includes protection, nurturance, and stimulation. This unit needs to be met by the patient's own efforts. The nurse is an external factor and may be needed to maintain equilibrium between the units. This slide reviews some of the key concepts to understanding Johnson's behavioral system model and how each concept goes hand in hand with the overall concept of the model. This slide demonstrates the schematic of Johnson's behavioral system model and how the patient, environment, health, and nursing all play an interrelated role in maintaining the stability of the 7 subsystems. Johnson's behavioral system model has been used for nursing education, practice, and administration. In education, many use the system to create assessment tools. A nurse curriculum based on the behavioral model will have straightforward goals and course planning. At UCLA, her theory is used for new graduate orientation by administration. Johnson's behavioral system model has been found effective with positively influencing patients' development throughout a variety of large age groups or settings. A few areas of usefulness in practice are modifying bullying in adolescence and impacting end-of-life care. This slide and the next demonstrates a case study using Johnson's behavioral system model to determine which of her subsystems are imbalanced to determine nursing interventions that can externally assist her in regaining an equilibrium state. Please feel free to pause the video and completely read the case study. Using nursing interventions based off the earlier assessment, we have aided in the stability of her subsystems. Parts of Johnson's model have been used and tested through nursing research. More than 20 research studies have been conducted. The studies have focused on both physical and cognitive health domains and tested through patient care outcomes. Key concepts of the article were to identify if a nursing theory such as Johnson's behavioral system model could generate an understanding about a holistic human health-related need. They used a sample of 150 heart failure patients split into an experimental and control group to determine if nurse-led care based on optimizing the balance and functioning of one's behavioral system make a difference. The nurse-led group first assessed the balance of each subsystem and aimed to fulfill the functional requirements of the subsystems as external regulators over a 2-week period. The results showed how a nurse-led program based on Johnson's behavioral system model improved system balance when holistic care was provided and determined the system can effectively determine nursing care. The simplicity of the theory lies in the linear relationship between the subsystems, structural component, and function. The theory becomes complex due to the intricate relationship between the level of subsystems, different structural components, and various functions. There are many interrelationships among the behavioral system, subsystems, and the environment. Middle-range theories are simple and straightforward. They use a limited number of variables, focus on patient problems and the outcome of nursing interventions, and they are specific to nursing and an area of practice. This study used Johnson's behavioral system model and focused on the sustenance imperatives related to the model and the effects toward chronically ill children. The sustenance imperatives included protection, nurturance, and stimulation. The authors used this information to conduct a research project to determine how the activities of chronically ill school-age children are affected by their environmental variables. Thank you.